of Labor and Industry. And then following Kyle, we'll hear from Karen Renshaw, and she is the owner of Diamond HR. So a couple experts with us. We do have the printouts from the Department of Labor presentations, so you can grab that up there if you want to take notes on that. And we will share those presentations with you following the meeting as well. And this is also being recorded, so Becca's going to put it on our YouTube channel also. If you have anyone on your teams or anyone else that you talk to that would like to see it, that will be an option as well. On that note, I'm going to pass it off to Kyle Euchre.
Hi everybody, my name's Kyle. I am a labor investigator at the Department of Labor and Industry. I've been there for about 3.5 years now. Prior to that I did some work in law enforcement. So basically what I'm here to talk about today is the new Earned Sick and Safe Time law. Goes into effect January 1st of 2024. So just kind of an overview. This will be a very brief high-level overview. I can answer some questions, but you have to kind of understand that this law is growing. We have to determine the ways we're going to enforce it, the ways we're going to interpret it, the way you guys are going to interpret it. So this is going to be essentially a learning experience for everybody here. So let's kind of get into it here. So what is Earned Sick and Safe Time, or excuse me, why Earned Sick and Safe Time? It allows workers to prioritize their care, promotes preventative and public health, ensures paid leave access regardless of income level, and improves employee recruitment and retention. And then doesn't really matter for you guys since most of y'all are down here. Minneapolis, St. Paul, Duluth, and now Bloomington have their own Earned Sick and Safe Time ordinances. There's been discussions on how the state law is going to interact with their ordinances, but unless you have a business in any of those 4 cities, you don't have to worry about it. So this kind of came out because of COVID. Everybody recalls their federal government gave out 2 weeks of paid sick leave for anybody that was quarantining or had COVID or COVID-like symptoms. This kind of resulted from that. Kind of had been discussed years prior to it, but it kind of got a nice healthy shove right into it after COVID. So, next slide, please. So again, January 1st, 2024 goes into effect. There is a current sick and safe leave law that remains in effect until December 31st, 2023. This sick and safe leave law really only pertains to employers that offer sick time to an employee. It guarantees that the sick leave that's offered to the employee is also extended for the employee to use for family members for sick time or appointments, anything like that, or domestic violence leave. So again, sick and safe time is paid time off that employees in Minnesota can use for certain reasons, including when they are sick, to care for a sick family member, or to seek assistance if they or a family member have experienced domestic violence or domestic abuse. So who is eligible for sick and safe time? This is kind of one of the biggest questions we have. It is any employee in the state of Minnesota. Doesn't matter if they're casual, part-time, full-time, work once a week, every week in the year. The employee has to work at least 80 hours in a year, and they must not be a bona fide independent contractor. So to be an independent contractor, there is a nine-step test to it. It's kind of all or nothing. If you miss one of the steps, you're not an independent contractor. Something we kind of see in my line of work is employers stating that I don't have employees, I have independent contractors. Just because you call somebody an independent contractor does not make it that. They have to actually be a bona fide independent contractor. So again, the employee has to work at least 80 hours a year and not be an independent contractor. All right, so how much sick and safe time can employees accrue? They accrue 1 hour for every 30 hours worked, and can earn a maximum of 48 hours each year unless the employer agrees to a higher amount. So if you as employers already offer PTO or sick time, and it's more than the sick time or the Earned Sick and Safe Time statute, really there's not going to be a whole lot you're going to have to change other than maybe a paragraph or 2 in your employee handbook. And then at what rate must sick and safe time be paid? This is, it's pretty flat, pretty forward. That whatever hourly rate that the employee works or would be working for that shift, that's what they'll be paid. So we realize sometimes in restaurant industries, there'll be a general manager that some days they're a general manager, some days they pick up shifts to work as a bartender, some days they pick up shifts to work as a server. Whatever shift they are calling out for, or they're not going to work, that's what the rate would be. So if they get paid less to be a bartender and they are scheduled to be a bartender this day and they wake up and they have the flu, that manager would not be paid at the manager's rate of pay, they'd be paid at the bartender rate of pay, whatever it would be in that case. And what family members are included. So this is the biggest change in the statute, at least for employers that are going to have to be in compliance with the statute. It goes very, very far out to aunts, uncles, husband, wife, father, daughter, somebody, it's called a loco parentis, basically saying, somebody that's functioning as a parent to this child, that means they are covered. It also includes like domestic partnerships, if you're, somebody's a longtime boyfriend or girlfriend and living together. It also includes once per year, the employee can elect one person to be covered under this. So say there's a large family that has, somebody gets cancer and they need to be bringing them to cancer treatment, this employee can elect that individual to be covered under the sick and safe leave, so they can take that sick and safe time to help with any cancer treatments or any type of medical events that may happen. All right, so employees can use their earned sick and safe time for any of the following. And I'm going to kind of stop here and say, kind of put a caveat. Some of these items here do not have set definitions. They're very, very broad, such as an employee's physical or mental or physical illness treatment or preventative care. There is no definition of what a mental or physical illness is at this point in time with the statute. A family member's mental or physical illness treatment or preventative care. An absence due to domestic abuse, sexual assault, or stalking of the employee or an employee's family member. The closure of an employee's workplace due to weather or public emergency, or closure of a family member's school or care facility due to weather or public emergency. So if a parent has a child and their daycare or school was closed that day and they need to provide childcare, they can use that earned sick and safe time for it. But again, it's very specific. We had a question in a previous presentation I had where they asked, okay, we have plow truck drivers and their children are in different school districts. What if one school district closes but not the other? According to the statute, the school district that closes and whatever, if the plow truck driver has children in that district, only that plow truck driver can take that time off, not all of them. And then, like I said, the kind of COVID kind of gave it a healthy shove. When determined by a health authority or healthcare professional that the employee or family member is at risk of infecting others with a communicable disease. Next slide. So the current sick and safe time ordinances, again, that's not going to be much you guys have to worry about, but the interaction with paid time off programs is a big question we get here. So you can offer a more generous generous PTO program and still be covered under this statute, so long as you allow the employee to use it for the sick and safe time reasons. So kind of what we discussed with employers that already have PTO programs is to basically, just open it up for, you can use it for whatever reason. We have a lot of employers saying that I've talked to saying, we don't even ask what it's for, we just let them take it. As long as you have the language written down that you can use it for earned sick and safe time, and you have at least the minimum amount offered from you that meets compliance with the statute, you as the employer have met your burden with that statute. So there's going to be other things as the employer that are going to be changes. I'm sure everybody here does employee notices. When new employees are hired, tells you essentially the name and full legal name of the employer, their pay dates, their rate of pay, how much leave they accrue, what pay days they're on, the 7-day work week, things along those lines. So it's going to have to be included on the employee notice for employees when they are hired and whenever rates of pay changes or anything like that, as well as the earnings statement. A lot of employers that have PTO will include it on the earnings statement already, but for employers that don't have any PTO and are gonna be required to now offer earned sick and save time, you are gonna have to put the hours accrued, the hours, used, and the hours available on the earning statement. And then you can go onto our website here, and that will kind of talk about everything the way it needs to be on the earning statement. So there's two options of how you can provide this earn sick and save time. Well, actually three. First option is pretty straightforward. It's you earn as you go, you accrue. For every 30 hours, you put an hour into their earn sick and save time bank. Then there is the other option that kind of gets split into two called front loading. So if you have an employee where you, based off of business needs, you know that they're going to work more than 2,000 hours a year, or they're going to earn the maximum 48 hours, you can dump 48 hours in their that first year into their earn sick and save time bank. And then at the end of the year, this is kind of where it gets tricky. You can allow them to carry it over, and you don't have to pay any PTO out, or it's not PTO, excuse me, earn sick and save time. If you decide that you don't want them to carry it over for any myriad of reasons, that maybe you're so small you don't want employees having very large banks, you can pay out whatever's left at the end of the year and front load 48, or you can front load 48 up to 80 hours in that second year. It's kind of difficult to explain, but essentially the only time you'll ever have to pay out earn sick and save time that isn't actually physically being used for time off would be if you don't want to allow an employee to carry over earn sick and save time from year to year. The cap that I call it the minimum maximum that the state requires employers to have is you cap it up at 80 hours at the bank if you're going to allow carryover. So once those employees are in 80 hours, if you as an employer don't want to have them have any more in their bank for whatever reason, you don't have to provide any more than 80 hours to them in their bank. Now, if they were to fall below that 80 hours, you would have to allow them to accrue back up. If you did a front load method at the beginning of the year and you got them up to 80 hours and they fell below that 80 hours through the course of that year, you would not have to provide any more until the next subsequent year based off the front loading method. So other key details here. So the notice of use. So an employer can put in a policy that for what's known as foreseen events, a wellness check, a doctor's appointment, anything like that. You can put in a policy requiring the employee to provide 3 days notice for something that could be considered foreseen. Most people, whenever you make a doctor's appointment, I just happened to make one yesterday and I couldn't get in until the middle of December. So that'll provide a little bit more on the employer side of it. And then you cannot require a doctor's note unless it's been 3 consecutive days. So a little kind of nuance with the doctor's note. You can require an employee to provide a doctor's note after 3 days. However, the employee can also be allowed to self-attest. So say the employee was home with the flu and they didn't go to the doctor for whatever reason, you can allow the employee to attest that I was sick. And then this is generally geared towards restaurants, but for any employer, you cannot require an employee to find a replacement worker to cover their shift as a condition of taking this earn sick and save time. You can have some type of informal request saying, hey, can you try to find somebody to cover your shift that you're going to be calling out, but you can't require them to find the coverage to take the earn sick and save time. So increments of time. So the way you track your time for your employees is how you're going to track the earn sick and save time. So I use the example of the state of Minnesota. We track our time by 15-minute blocks. So my workday goes by 15-minute blocks. My vacation and sick time is also tracked by 15-minute blocks. You as the employer can't track the employee down to the minute for hours worked, and then say you can only take earn sick and save time in 2-hour blocks or 1-hour blocks. If you track it down to the minute for work, you have to track it down to the minute for earn sick and save time. If you track 15 minutes for work, 15 minutes for earn sick and save time. Termination, reinstatement, employer succession. So when an employee is terminated or resigned, there is 0 requirement to pay out any unused earn sick and save time. You can, but there's no requirement. The employee, if they resign or terminated, and come back within 180 days, this is kind of geared towards temporary workers for cities or anywhere else for that matter. If you come back within 180 days, you are entitled back to your bank of hours. So a question that we've had about earned sick and save time, what if you as the employer pay out this earned sick and save time to your employee that gave a 2-week notice when they resigned, and they're a good employee, we're gonna pay out this earned sick and save time. And then 2 months later, they decide, hey, I wanna come back to my job. Kind of the route, or kind of the view we're taking on it is, if you pay that earned sick and save time out to them, we're gonna kind of look at that as it's been used. So you're not gonna be required as the employer to pay it out, and then they come back 2 months later and then provide them the exact same bank they had. And then employer succession. So if you as an employer or you purchase another company and you keep the employees on, those employees that are kept on to that company that's purchased are still entitled to their bank of hours of earned sick and save time that they have accrued up to that point. And then constructive collective bargaining agreements. There are carve-outs for the collective bargaining agreements that when you're working with like the carpenters union or something like that, where you may not have to pay or you may not have to provide earned sick and save time because there is a CBA involved already. All right, we'll kind of just go past this. There were some grants at the beginning or middle of the summer that were already provided out, so there's not really a whole lot we can do about that now, and they were provided in August. So those hop forward here. And then resources, earn sick and save time. You can go to our website. We are putting new FAQs on weekly, if not daily. We have mock employee notices coming up soon, fact sheets, workplace poster will be coming up soon, videos. You can contact this hotline here at the 651-284-5075 or this email address at dli.laborstandards@state.mn.us. Who knows, maybe it'll get me on the phone or the email. And then you can also sign up for the wage and hour bulletin. It comes out, I believe, monthly. It just kind of gives you updates on things in the whole wage hour realm of DLI. And then that would be it. What are we going to do? Questions right now or wait for?
Should we go after Karen?
Yeah, well, yeah, I'm going to answer quite a few, I think.
Thank you.
I thought you were up 13. Do you want me to change something?
Well, no, I just helped. Hey, everybody, good morning. If you like your chairs, they are for sale. So just kind of, let them know on your way out. I am Karen Renshaw. A lot of you I know I've met. I have been in, Red Wing almost 20 years, I think. My background is, my background is I have a legal background. I do have a law degree. I practiced law, 20 years ago. Don't practice it anymore for about the reasons that you can about imagine, but then did some tax stuff. And then about 8 years ago, I fell into HR by accident. Absolutely loved it. If you think about it, HR really kind of is legal and tax with a lot of personal service. So that's kind of where I'm going right now. Started my own small business to consult, although actually really I'm more of an independent contractor for small businesses and nonprofits. People that need HR but can't afford to hire their own for obvious reasons. So again, I'm more of an independent contractor. So you wouldn't have to pay me sick and save time because I'm your independent contractor. But I offer a lot of services, and I'm not going to go into that because this is an informational, not a marketing thing. But anything that you would do. So I will do hourly rates for you. I'll provide forms and handbooks and compliance and all sorts of different things. So if you want that, I've got my card. Ask later, but actually that's not why I'm here. So let's go on. Can you go to 19? Yeah. I have a 1-hour presentation that I do too, and in fact we'll be at the Elks next Thursday, a week from tomorrow at noon and at 4:30. What I'm really concerned about, I am thrilled that you guys are here, you know about it, but I am amazed at how many people out there have never heard of it. and they need to start doing this. So if you could please get the word out to all your colleagues out there to, try to figure out what's going on, that would be great. But my 1 hour presentation, a lot of it Kyle already did, so I'm gonna kind of drop in the middle and go from there. Being I have an HR background, mine is gonna be more on how you actually do the nuts and bolts. Not so much what, big picture what it is, but I have been at a couple different seminars, so I have a lot of the questions people asked in here. Like, I will ditto what Kyle said. Law just came out, goes into effect in January. A lot of the answers aren't there yet. So we are just kind of going where we can go. So if something is said, it may change, or I've asked Kyle, if I say something that is not what you guys think, please let us know, and we'll just keep the information coming. But this is what I've got so far. So how do you keep it going? You run it with your payroll. So if you do a bi-weekly payroll, you do a bi-weekly accrual. That's how it works. If you do a weekly, you do weekly, whatever. You can't hold it off and do it once a month. You got to do it with your payroll as it goes. You calculate on a year basis, but you get to pick the year. You can do it on a calendar year, you can do it on a fiscal year if you have a different one, or you can do it on an anniversary year of the employee. However best works for you. On January 1st, everybody has to start regardless of which one you're going to use, but you can kind of base it from there. So you get to pick what you want to do. After January 1st, new employees that come on start accruing on their start date. So regardless of what year you use, they start accruing on day one. Nothing we can do about that. All right, so here's an accrual example, really nice. You accrue 1 hour for 30 hours. You have an employee that works 30 hours a week. That would be great. So week 1, 2, 3, 4, they work 30 hours each week. You add a year-to-date total. We don't necessarily care how much they work that week as much as how much they worked for the entire year. So they'll work 30 hours, 60, then 90, then 120. You take that year-to-date total and divide it by 30 hours. So they've got 1, 2, 3, 4. Nice, because these all even out divided by 30, so that would be accrual. They've accrued 1, 2, 3, 4. Okay, next slide. Let's have a person that works 40 hours. Week 1, 2, 3, 4, they work 40 hours. Again, we're doing the year-to-date total, 40, 80, 120, 160. We divide by 30. Well, now it gets a little weird because we have percentages. We don't care about the percentages. We talked about when you actually take time off, you can take like a half an hour, but when you accrue it, it has to be 30 whole hours or it doesn't matter. So drop the percentage. So 1.33 would be 1. Then I've got 2, then I've got 4, then I've got 5. So you look at a 40-hour person now has 5 hours accrued in 4 weeks, not just 3 or not just 4. So that's kind of how you run it. Okay, now what about an hourly employee that's all over the board? They work 10 hours, 23, 6, 18. Again, you add up all, year to date, divide by 30, and then you add it. So 0.33 is not a 1. That doesn't count. We drop the fraction. They get 0 hours earned that week. But then they've got 110. They get 1 hour, 1 hour. 190 is close to 2, but it's not 2. It is not 60 hours. It's only 57. So they still only have 1 hour. It's all based on year to date, not your actual hourly. All right, let's do now, that was people, they actually use some. So we've got the 40 example again, all to where their numbers were here. Let's say they use 1, they use 2. Well, pretty easy. You've got the accrual. Now you just say they used 1, they didn't use any, they still have 1, they used 2, they've used 3. Okay? Then it's easy. Year-to-date accrued minus year-to-date used. They accrued 1, they didn't use any, they've got 1, they used 2, they got 1. They accrued 4, they used 1, 3, they now have 5, they used 3, 2. Basic math. That's as easy as it is. Now I say that's as easy as it is, it's not that easy when you actually have to do it every week for every employee, but that's that. Okay, next. Now, I'm gonna be careful. Melissa and I, where are you, Melissa? We're at a seminar last night, and we actually sat at a table last night, and this came up, I had never thought of this. That the one we just said, okay, 40 hours a week, every 30 hours you accrue, after 4 you've got 5. Well, what if you already allow 48 hours a year? And we said as long as you're doing what you're doing, we're doing the max, the minimum, you don't have to do anything different. So it's like, oh, well, the max is 48 hours, we offer 48 hours, we don't have to do anything different. Well, normally when you do that, you do it equally. If you had 48 hours that you allow and you have 24 pay periods, you'd get 2 hours every pay period, 24 pay periods. So you know, first week you don't get a paycheck, there's nothing. Second week you get your 2 hours. Next week you don't get anything, there's no paycheck. Next week you get 2 hours. So you have 0, then you have 2, nothing, it stays at 2, now you have 4. But compare that about having to do it at 30 hours rather than dividing it equally all year. You should have had 1 hour, you haven't given them any of that first hour because they didn't get a paycheck. They should have had 2, well that looks pretty good. They should have had 4, you've only given them 2. They should have had 5, you've only given them 4. So if you are close to that 48, if you're more than that, if you give 120 hours, you can accrue equally because you're gonna be over this 30. You're gonna be over, you know, what you need. But if you're really close to that, you're gonna wanna make sure that you're giving them sooner rather than later. You can't divide it all year. It's 1 hour for every 30 hours. Okay. All right, so let's try, you know, this kind of got mixed up. Do you wanna? All right, we may be jumping around. Sorry, I sent this yesterday in. The 3 methods that Kyle talked about is you can do accrual, and at the end of the year, if they have any, you can have them carried over. So they can accrue up to at least 40 hours a year. 1 hour for every 30 hours. When they hit 48 hours, they're done accruing, they stop. Until they use some of those hours, then they start again. They can carry it over from year to year. That's mandated, whether you do it now or not. You can now, if you use the accrual method. You carry 48 hours the first year, you carry 48 hours the second year. No, the max you can carry over in your bank is 80 hours. And again, however many years you go, 1, 2, 3, and I'll show you a screen for that, but when you hit 80 again, total in your bank, you stop accruing. So 48 in 1 year, you stop, 80 total, you stop accruing until those are used. Okay. No, that's okay. No, that's okay. Go to example 1. All right, oh, here's the one that I just did. So say you've got your 30 hours after year 1. Now 48, you're into year 2. I stopped, it's June, but I hit 48, so I'm done. I stop accruing. So now I have a total of 78. By the end of the year, I still have 78, so that's okay. That rolls over into year 3. I hit 2 in year 3 in January. Now I'm at 80. Again, I stop accruing until I use some of them, and then I come back. All right, that's kind of the same. The other two, that 2 and 3 method. Okay, so accrual, you accrual like normal, and then you have to carry over. That's what you do. You also have the option to do a front loading, which means you give them either the full 48 hours at the beginning of the year, or however many you would normally give them. A lot of you do that now. You give everybody their PTO at the beginning of the year. Or you can give them the total 80 hours, and that is a little bit different. Okay, so you front load 80, or you front load 48. Now, it has a little bit different. If you front load 48, say they use 40 by the end of the year, they've got 8, you pay out 8. That's what you do. You know, you front load 48, you pay out 8. Going into the new year, you will front load 48 again. They'll start all over. That is because it's a yearly thing. If you front load 80, that's the max you can accrue. Say you only used 40, or, you know, so now I have 48 or whatever. I can't, all right, say I use 72 or whatever. Okay, I have 8 remaining. I don't have to pay out any, and I don't have to carry over any, because I'm starting again the next day with 80 hours. That's the max you can have. I know it sounds a little weird if you think about it. I had to think about it for a while, but so if you're preloading 48 hours, you have to pay out at the end of the year. If you're preloading 80 hours, no payout, no load. You just roll over again to 80 hours. You can ask me about this later. I'll stay as long as I need it. Okay. Okay, remember, when we're talking about all of this, a lot of business owners, a lot of HR people are very left-brained, so we want to, you know, attach to the little words. But the purpose, the whole purpose of this law is to give paid time off for people that don't already have it. So don't get so caught up in, we have a current policy right now, do I have to, oh, I have to come down to this? No, you don't. If you have a current policy now, it can stay as it is as long as it meets the minimum, probably with the only thing of you've got to start accruing day one, which most of you guys who have benefits, it's first of the month after 30, after 60, after 90 days. Other than starting on day one, don't get wrapped up in having to come down. Stay where you are. Stay where your PTO policy is. Yep, so again, not, okay, yeah. All right, now, Kyle talked about this a little bit, moving around at work, okay. You don't need to pay out at termination, you can. If you move within the company, department to department, you have to take them with you. You can't restart again if you're a different department. And he talked about if you come back within 180 days. You have to give that person, that matches your health insurance.
Slide on you if you want to go for the full-time, part-time.
Okay. Full-time and non-full-time, non-full-time being part-time, seasonal, occasional, can be treated differently. As long as everyone gets the minimum that they're entitled to and you're not discriminating against anybody. So, like we said, if you've got full-time people now that are getting PTO that are better than this is, leave it as is. If you've got part-time, occasional, seasonal people that don't have it, create a new policy for them. It's okay that they're different and make that mirror what the new safe and sick time law is. That's okay, as long as you're, they're getting at least the minimum. Okay. He talked about this a little bit. Employees cannot be required to find their replacements. Oh, attendance policies cannot be negatively affected for hours. If you've got attendance, perfect attendance, and they're using their sick time, you cannot count it against them. They still have perfect attendance. If, this is an interesting one, we get this all the time and there's not a lot of different answers. They work an 8-hour shift and they call in for the day, but they only have 2 hours sick and safe time. You give them the 2 hours sick and safe time, just like you would, through anything else. Those other 6 hours are not protected. So if you've got a point system, you can count those. You can count those. If they didn't call in, you can use those. So treat those 6 hours however you would if they hadn't used the time. Now I know that gets a little weird because some of you have policies that are a little more specific than that, but that's the general idea. Do they have to use it? We don't know. They do not. Okay, so they do not have to. A lot of you have PTO policies that if you're sick, you have to use your PTO. You don't have to for this. They can choose to use it or not. There are not currently any grants, loans, any financial help whatsoever for an employer who needs a little bit more money to pay the people. It just isn't there. Now, hopefully, call your legislatures and we'll get something passed. I don't know, but right now there isn't really any help. Okey doke.
Just one quick thing.
Yeah.
Can you go back really quick? You talked about you don't have to use sick time if they call in. Is that what you just stated? Can you just elaborate on that?
If the employee doesn't want to use their earned sick and safe time for their time off, they lose the protections of earned sick and safe time, so you could count it against their attendance policy or anything like that.
Okay.
So there's no requirement for them to use it when they call out. It's kind of up to you. If they say they want to use it, then they have the protections under the law. If they say they just want to call out and not use their earned sick and safe time and just have it be unpaid, then they're not required to use it, and then they don't have the protections of the law.
I have a clarifying question on that also. Kind of piggybacking off of that, so somebody has a PTO policy and they're calling in sick. Do they, when they call in, say, I'm just using PTO or I'm using sick and safe time? And then how is that treated differently? Is it treated differently? Because I only think about that if you get paid out for sick and safe time at the end of the year, but you don't get paid out for PTO, that's like a whole nother tracking system that I think kind of complicates things. But to elaborate a little further, I sit on school board for Lake City School District, and we just got model language for that contract. And in that contract, it says they have to use sick and safe time first which sounds like an FMLA policy, and I just want to clarify kind of if that actually is true or if that's just something that's written in there.
Yeah, that's a good question. So FMLA is done at the federal level. We're not quite sure how it's going to interact with the earn sick and save time here. But in terms of paying it out with PTO, like you said, if you have your entire PTO program geared to be earn sick and save time and you don't kind of parse them out, there's still no requirement to pay it out so long as you allow them to carry over. I didn't want to stop you. As long as you allow them to carry over, even if you're loading 48 hours each year, then you don't have to pay anything out. That's just so the only time you'll ever pay out if there's no carryover. So yeah, your situation, if the PTO was all geared to be earned sick and save time, or at least made available for earned sick and save time, then you've done more than enough to meet your burden.
Great, okay. Go to the next one? Yes, Jerry.
On that note, on the PTO versus earned sick and safe leave, if an employee takes all of their, let's say the PTO program allows 80 hours, which is pretty common,
Right, I know where you're going, yeah.
and I take my 80 hours of vacation,
Your SOL.
and then I say, I'm sick, and I want 3 days of earned sick and safe leave,
Right, it's too bad. You had your choice.
and that's okay.
Correct.
You had your choice.
And I, as an employer, don't have to police that by saying, well, you need to save,
Right.
you know, your accrued.
Because again, your PTO offered better than the minimum and their choice.
And I don't have to keep track as an employer
Right, if,
of how they're using that. As long as I'm meeting the minimum requirement, my PTO plan is compliant, and I can sort of ignore the sick and safe leave
right,
and not parse it out when
Right.
why the employee is gone.
right.
I have
Correct.
a question about that. So, currently we have a 2-hour minimum for PTO. So, do we have to allow them to take hours, of the PTO?
Yeah.
It can't have increments of 2 hours anymore.
You have to allow them to take it at how they are paid. So if they are paid by 15-minute increments, then you need to allow them to take it at 15-minute increments. Now, is that different if you use an overall PTO policy, a higher one?
So you're gonna have to just allow them to take it however you track your hours worked. That's gonna be one of the changes if you're just having it all rolled into PTO. You can't require them to use a minimum of 2 hours. You have to allow them to use it as they choose.
So a salaried person,
Right. Salaried, this came up last night too. Salaried people, again, you treat them like you always did as a salaried person. We're gonna assume they work 40 hours a week. If they can prove differently, they work less or they work more, you can look differently, but we're gonna assume they're 40. If you let your person leave for an hour to go to the dentist and come back and make up that time because they're salaried, they do not have to request sick and safe. You can do it just like you always did. If they were gonna call in and say, I want 4 hours off because I have something, they request it and they would normally get PTO, that's sick and safe time. So a salaried person is treated just like a salaried person always was. They don't have to come down to that level and change anything as long as they're getting at least the minimum.
Just to kind of piggyback on what you were saying, so let's say, again, most employers have the medium policy. So right now, we don't have to necessarily say, like, have blocks, like this was earn sick and safe time versus just PTO. Like, okay, you went to the beach versus you were sick. You got 80 hours, you can use it, and we don't have to police
That's true.
and like basically label and code it.
Yep, that's true. Kind of this piggybacking on Jerry. If you have PTO, you don't have to watch whether it's sick or vacation. That's up to them. They can use it for sick, so it's on them.
so I have another question in regards to a new hire. If we don't have a sick and safe, we have a good policy for the PTO, and we accrue it as they start.
Right.
They're able to take that time off
Immediately, as soon,
without waiting the 90 days.
as soon as they accrue it.
And
Yep.
we still don't have to, whether it's sick or safe, it's our PTO policy, So they would be able to take it right away.
Right, if they work 40 hours their first week, they can take an hour the second week. Yeah, okay. I'm gonna go through, I have a couple more just done, and then we can do questions and stay as long as, because I think you guys are probably gonna sneak it out here pretty quick. Okay, the employer notice. So as an employer, you need to give notice, written notice to your employees. On or before January 1st, everybody you have now, then as they start employment, and each new person as they come down. You can post it on the wall with your other posters, you can do it on a web-based platform, you can provide a paper copy, hand them to them, or you can electronically email it to them, or however you want, or any combination of that. If you have an employee handbook, you don't have to in the state of Minnesota, but if you do, there are certain things you are required to put in it, and one of them would be this information. So if you have an employee handbook, you're going to want to update that. Also, go to the next one. This says policies, but for policies, if you have an existing time off policy, you're going to want to update it. If you've got one that works for your people, you're going to want to add for sure one that happens to the new people that are under 40 hours, and make sure your wage and theft notice that you put that in there. When you put in vacation and time off, make sure you add that to your wage and theft notice. If you're not doing your wage and theft notice, Google it, because you need to be doing that. All right, we talked a little bit about this. Employee has a foreseeable absence, they can get 7 days. Ahead of time, they need to let you know unforeseeable as soon as they can. You can deny that leave if number one, you gave proper notice at the beginning, and number two, they gave you proper notice. I'm suggesting use a standard form. You create one so everybody's created equal, but more of that, we can do that later. All right, you get, next. Yep. All right, oh, there's my policies. If you don't have a current policy about time off, make one. If you have a current written policy, change it. We talked about that. If your policy is better than what we talked about, it's more than the 48 hours a year, you can. Also, you'll need to add that it begins at higher. You're gonna change those to your policies. Proof of illness, documentation. If they've gone for leave for more than 3 consecutive days, they can request documentation. If they don't have it, they can make it themselves if they think they can't get it. Now the question is, what if they're gone Friday, Saturday, Sunday? Is that 3 consecutive days? Well, my opinion would be no, because they are not using sick and safe on Saturday and Sunday. They are using sick and safe on Friday, Monday, Tuesday. Those are their consecutive days, or the days that they are actually using it. But, you know, that's kind of my opinion. And remember, all of this, HIPAA. They don't have to tell you why they're sick if they don't want to. They don't have to give you the gory details. Whatever they tell you, you need to keep private. So if they don't want to give you a lot of information, you got to go with it. Don't argue with them. Just give it to them, even though you know they probably weren't where they said they were. Now, if you see them on Facebook at the state fair, that's a little bit different, but that's a whole other issue. Okay, next one. Record keeping. Your pay stubs now need to include, and some of you already do this, need to include the total number of sick and safe time hours accrued all year, the total available for them to use, and what they just used in the last pay period. So they should be able to look at their paycheck and see that. You don't have to call it sick and safe time. You could call it PTO or whatever you want. You may be doing it now, but that's got to be on there somewhere. You're required to keep records of their hours worked as well as other information. That would be like if you do have requests that they have to ask for, you want to keep that. And you need to keep the records for 3 years. Pretty common. Enforcement. Minnesota Department of Labor is the enforcing agency. Any questions about that can go to him. There also is always the threat of your employee may bring a civil lawsuit against you. Now this is new law, never been tried before. You know, I'm not going to say they're going to start all suing you on January 15th, but please be aware of that. That's why we really need to start getting the word out to people that don't know. And some resources. I will stay here as long as you need, even if we're answering questions, but obviously Minnesota Department of Labor, I know there was a law, I know the Department of Labor needs to enforce it. If you think there's a difference, I'd go with the Department of Labor. There's no court in the world that's gonna say, I follow Department of Labor law. Well, you can't do that. They're gonna be okay with you. Go to their website. several times. There's frequently asked questions. There's a whole bunch of great information out there, and they update it on a pretty regular basis when the new stuff comes out. I'm also going to say Hiawatha Valley SHRM. That's the HR group in town. Jerry Olson is our current president. There's a lot of us in the room. You can join the group without being an HR person. We have a lot of business owners that just want to come and find out. That is a great resource. We did, a couple weeks ago, we did one of these. And so a lot of great resources come out in that group. Obviously me, I'm a consultant. I'm, like I said, not a sales group, but my most popular thing that I do is I have a monthly newsletter that's called the Compliance Newsletter, where every month I send you out anything that's changed. I'll send you the poster, I'll send you the new I-9, which goes into effect November 1st if you don't have it. I will send you what I know if a new policy comes or whatever. So that's another option. And also always an employment law attorney. I don't know that there's anybody in town that does specifically employment law, but I know, sure, we have one person that does our sessions for free that we can recommend that a lot of people in town use, but if anybody else knows of anyone they use that would be good, that's always an option too.
Okey-doke. Question.